पुरुषोत्तम जी सामने लाइट दिख रही है ना आपको, तो वही देखते रहना, ठीक है? थोड़ी देर में शुरू करेंगे, आपको दर्द नहीं होगा, कुछ नहीं होगा। Yeah, hi. Am I audible?
Yes, sir.
I'm not getting a feedback.
Yes, please go ahead.
Yeah, hi. Hi, Himanshu here. So we have a case here with the, after seeing Dr. Gaurav Luthra's lovely femtolaser surgery, we have a patient Purushottam here showing with posterior subcapsular cataract. Is the video visible there? Can I get a feedback? Saline cornea.
Yes, sir, we can see your video.
Oh, thank you. Thank you. Appreciate the feedback. Thanks so much. Is it in focus? पुरुषोत्तम जी दोनों आंख खोल दीजिए, सीधा लाइट में देखिए, सामने, सीधा नहीं, सीधा, दोनों आंख खोल दीजिए, लाइट में देखते रहिएगा, सीधा मेरी ओर देखिए। आवाज कहां से आ रही है जी? I'm a left-handed surgeon, so you'll see my movements will be ulta. Taking two side port with the MDR blade. Instilling oculan. Point two. पुरुषोत्तम जी सीधा देखिए आप यहाँ से, here we'll be injecting trypan blue for the purpose of demonstration. Any questions? Stop me in between, no problem. Straight to scope. होगा। कॉर्निया पे अप्रोक्स डाल दीजिए, सलाइन से क्लीन कर दीजिए थोड़ा। Rexis forceps and dialer in the other hand. दोनों आँख खोल के पुरुषोत्तम जी आप सीधा देखते रहिएगा। Hydrodissection. If I see a little more capsulocortical adhesions, I like to do a little more hydrodissection so that the zonules are less strained and I can move around my nucleus and the epinucleus well. Can I have some more fluid, please? लाइट में देखिए पुरुषोत्तम जी, यहाँ पे सब ठीक चल रहा है, बढ़िया चल रहा है। if the nucleus is or the epinucleus is not moving very well, I would be a little worried because I'm expecting a lot of capsulocortical adhesions, and in trying to remove them later, we could have more problems pulling on the. Yes, right now we will go with Pico 1. Yeah. Now is it better? Better now? Great. Irrigation constant. Fluidic. Like to clean off above the nucleus, create space, debulk the nucleus if I can in the beginning. Get the feel of how my nucleus is going to be. Soft cataract, so I'm just kind of cornea saline, please. New environments, I'll generally go a little slow rather than going to Phaco 2 and chopping it directly. Judging the depth of my nucleus. Initiating the crack. Phaco 3. As I always put it, being a little more biased toward the femto laser, I always put it 80% of your job is done with your rexis. If your rexis is good, you have achieved the best possible step in your surgery. And most of your problems are sorted out once your rexis is decent enough. Am I in focus, Gaurav? And as always, viscoelastic in my right hand. Before exiting, I would always like to Stop continuous irrigation, please. Fill the chamber for whatever it is worth. A good practice overall in the long run. And I'm a bimanual, I'm biased towards a bimanual. पुरुषोत्तम जी सीधा देखिए, ठीक चल रहा है सब, लाइट देखते रहिएगा, जी लाइट देखते रहिएगा. इरिगेशन एस्पिरेशन. Generally, the first vortex to be taken would be subincisional, so that you are okay with the whole thing. You see, there was this white stuff which is there, which can sometimes create problems if you haven't had a good amount of hydrodelineation done in the beginning. Gaurav has been kind enough to give me a soft cataract today. I can always change my hands. लाइट में देखिएगा पुरुषोत्तम जी, आप सीधा सब ठीक चल रहा है, सीधा देखिएगा. इसको लास्ट है. Thank you, Gaurav. Lens, I've been fortunate enough to get the CRV lens, Synergy, thanks to Gaurav and Johnson & Johnson. It's a 24 diopter lens. Yeah, so continuous vision across all ranges that you are aware of today. If we have to use this lens in a multifocal that we have, give me a 1 and 2 please. आप यहाँ जाइए थोड़ा. हाँ, I'm increasing my incision size here because my injector is a little bigger injector. And I don't want to struggle. Instead of the pusher, I generally like the injector, which is a screwable injector. So you have more control over it. Today, I have the pusher with me in one hand. So I have to be careful because suddenly you may get a release phenomena. And all of us who have been used to a pusher have seen sometime in life that we have got into problems. I'm extremely gentle with it. In my right hand, always I would have the I'll be extreme gentle toward the end because that sudden push can sometimes give you a big thrust into the eye. इसको इलास्टिक दीजिएगा थोड़ा. We were all happy with the previous restore lens. Then we saw the Symphony, then we saw the EDOF, we saw the bifocal, trifocal, extended depth. We have the Synergy here, and what we are seeing here is that continuous vision across the range empowers the patient to see at their ideal distances, outstanding near visual performance at 33 centimeters. And low light contrast, the biggest thing that people used to complain about multifocal was contrast and low light problems. That's one thing which you will see that these patients don't complain too much about. You have to be good with your formulae here because You rather be on that, and you might try to do a micro monovision between the two, a 0.25 diopter difference between the two. Once your lens is centered, I would love to remove the viscoelastic, and of course, if there is a toric lens associated with the multifocal, with either a Callisto and or a Varion, I would be able to mark that lens well. Here, it's fairly decent. I have to take a lot of pain to remove all the viscoelastic that might be there at any given point of time. And of course, I definitely make it a point to inject below the lens to remove all the viscoelastic, that much I can. सीधा देखिएगा पुरुषोत्तम जी आप. Fortunately, that little conjunctival chemosis is helping me to cover up the upper wound. थोड़ा नीचे देखिएगा. सीधा देखिए. ये छोटा कैन्यूले के साथ दीजिए. हाँ. And one more thing, after removing the, yeah, ठीक है, ऊपर से डाल. The speculum, I would like to see whether the chamber is collapsing or whether or not the pressure was responsible. Then one last push for my wounds to be sealed. Thank you very much, Gaurav, for giving me a good case. Thank you very much, everyone. पुरुषोत्तम जी, ऑपरेशन हो गया, बढ़िया हो गया.